your student nurse, and I'll be doing your vital signs today, including your checking for your cardiac and respiratory today, okay?
Okay.
I'm going to do my hand hygiene, and I'm going to provide the privacy. Can you verify your name and your date of birth for me?
Reagan Newton, May 15, 2001.
Okay, and it matches your wristband. And Reagan, are you having any pain today?
Yeah, a little bit.
Where's your pain today?
It's kind of like in my ankle area.
Okay, what were you doing when the pain started?
I was running and I tripped.
You were running and you tripped. Okay, and tell me about the pain. Is it like a sting, like an aching, or
It kind of feels like a pinching feeling.
like a pinching feeling? Okay, and then how long does the pain usually last when it happens? Is it
Whenever
like
I'm using it, it hurts.
Okay, does it last all day, or is it like just the shooting pain once in a while?
Yeah, shooting pain when it's in like certain positions.
Okay, all right. And have you, on a scale from 1 to 10, what would you rate the pain? 10 being the worst.
Probably about a 3.
Okay, and have you taken anything at home to help alleviate the pain?
No, I haven't.
Okay, you haven't seen the doctor either, I guess?
No,
or
not yet.
appointment? Okay, and then how does it affect your daily life?
It's making it difficult to walk around and move about.
Good. And just to make sure, does it radiate anywhere else in your body, or is it just
I think it's pretty much just in that one area.
Okay, all right. So I'm gonna clean my stethoscope. I'm gonna on the bell in the diaphragm side. I'm going to listen to. Actually, I'm gonna check your pulses first. Okay, on the top extremity. Okay. So I'm gonna have you lean back for me a little bit, and I'm gonna come here. Can you look to that side over for me? And I have you cough. Okay. I don't see distension in your jugular, and then cough again for me on the side. Okay, neither, so you don't have any JVD, so you're good. Make sure I'll move that. I'm going to check your arms. Alright, I'm checking for your capillaries. It's less than 3 seconds, you're good. I'm going to check for any edema in your arms. I don't feel any. Okay, I know you're a little bit cold. I'm going to check your radial pulse. Do you mind taking that watch off so I can...
Yeah.
I'm going to check your radial pulse on both arms. It's going to be on kind of the outside where your thumb is, outside area where your thumb is. Have you relax for me right now, okay? Alright, your radial pulse is +2 bilaterally, and then I'm going to just point out some areas for your brachial. It's going to be your inner arm, where kind of with the inside of your elbow, and that's where the brachial pulse is. The axillary is going to be kind of underneath your armpit on both sides, and then your carotid is going to be right above here. It's going to be right underneath your jaw. And I'm not going to check it, but if we were to check the carotid, we would do one at a time just to prevent syncopation. Okay. Everything else looks good. The upper extremities looks good. I'm going to listen to your heart, and I'm also going to listen to your lungs. Okay. All right. Are you okay?
Yeah, that's fine.
Okay. I'm going to find your midclavicular line. I'm going to go down to your second intercostal space to listen to your aortic. Okay, normal S1, S2. I'm going to go right across. Again, still staying in the second intercostal space. And listen to your pulmonic. Okay, that's normal S1, S2. And your herb is going to be your third intercostal space. Okay, normal S1, S2. And then your tricuspid, I know it's going to be kind of down here, okay? It's a weird area for, do you mind sitting up for me a little bit? Okay, let me know if you ever get uncomfortable, okay? It's going to be usually right in the fourth intercostal space. It's going to be probably down there, okay? And then it's normal S1 and S2 I hear. And then do you mind just lifting, you can just pretend if you want, yeah. And then usually for the mitral or the apical, it'll be right underneath the breast, so right underneath it. So but since she's uncomfortable, I'm just gonna pretend I'm hearing it. I'm just saying that. Alright, I'm just gonna, I may have to actually put it on there. Are you okay?
Yeah, that's
Okay.
fine.
Alright. Alright, I hear normal S1, S2 in the 5th intercostal space for your mitral. Now while I'm at it, I'm also going to listen to your lungs, okay? So I'm going to listen to your right, let's make sure, aortic is going to be on the right side of her body in the second intercostal space. I just want to clarify that the pulmonic's on the left side of the second intercostal space, herbs is the third intercostal space, and then on the left side, and then your tricuspid is on the fourth intercostal space, and then your mitral is going to be on the fifth intercostal space, okay? Now I'm going to listen to your lungs, okay? I'm going to start on the right upper lobe. Can you breathe for me? Okay. Can you breathe on the left upper lobe? Okay. And then it's gonna be right here. Okay. It's gonna be underneath, usually under her breast area, but I'm just gonna put it right here for now. Okay. All right. And then can you breathe in for me? Thank you. And then the same side over here. All right. And I'm gonna listen to your lateral. I'm just gonna have you relax. Okay. And then take a deep breath for me. And the same thing over here. Take a deep breath, just face forward. Alright. Have you had any breathing problems that you know of?
No.
No? Okay. And do you have past history of heart disease or any heart attacks in the past that you know of, or anything in your family that may pertain to you?
No, I don't think so.
Okay. And are you having any shortness of breath at the time?
No.
Okay, good. Now I am going to listen to your to the back. Okay, have you stood up for me? Now I'm checking her left upper lobe first. Take a deep breath. All right, now I'm going over to the right upper lobe. Take a deep breath. Now I'm going down to the right lower lobe. Deep breath, thank you. And then over to the left lower lobe. Deep breath. Thank you. Alright, your anterior and posterior lungs, your front and back lungs, front of your lungs and your back of your lungs sound all clear. I don't hear any abnormal sounds. And then I'm just going to point out that I didn't use the bell because I did ask you if you had any histories of heart disease or anything, and you said no. But if you were to have any or any kind of concerns, I would I'll use my bell to check for any murmurs or any other sounds that are pretty low, low pitch. Okay. I think I already checked that. I'm going to do your BP while we're working on the upper extremities. Okay. You okay?
Yeah.
That's a lie.
No, I'm just impressed that you remembered all of it.
Okay. Ooh. Drop. Did you have a preferred arm you wanted to use?
You can use this one.
Okay.
If it's easier for you.
No problem. Do you have a, what's your usual normal range?
About 120, 80.
120 over 80? Okay. Now it should be, we'll put that strap on here. It should be snug. It should not fall off, but it should not be too tight. Okay? I'm going to line up to where your arm is, and I'm using your right arm. Okay. I'm going to find your brake. Okay. I just want you to relax, okay? I got about 118 over 78. Is that you?
Yeah.
Okay. All right. I'm gonna clean my equipment. I'm just put this to the side. And I'm gonna check for your radial, your resting rate, okay? Okay, I got about 80 beats per minute. And for your respiratory rate, I got about 13 breaths per minute, okay?
Okay.
I just want to clarify that for your heart rate, it was 80 beats per, not your heart rate, your pulse rate was 80 beats per minute, okay? Now, as I go down, I just want to make sure, I'm just going to point it out, that her femoral pulses will be right here and kind of inward thigh, and then already checked for your capillary pulse, so you're good. All right, and then her popliteal will be behind the knee, and then while I'm going down, well, actually, we'll feel it going up, but I'm gonna. Actually, I'll do that at the end. Screw that. So popliteal's in the back, and then I'm looking for your. I just get into while I'm at it, and then. All right, I'm gonna find your pulse for your posterior tibial. It's gonna be kind of inward.
My pulse is kind of hard to find.
Right. So I'm just gonna get under your slots real quick. Okay, I would say about a +1 bilateral on there, and then here I'm gonna find your dorsalis pubis. Your socks don't match.
It's always like that.
All right, I just wanna. Okay. And then your pulse is about pulse on your dorsalis pedis is about +2 bilateral. All right, I'm gonna wash my hands to make sure, since I just touched your feet. Now, I'm already felt your feet. I didn't feel any edemas. I'm feeling edemas down there, but I'm gonna feel your legs. Okay, and I don't feel any there too. Did you, I think I already asked you about if you had any, do you use oxygen or anything at home that you know of?
No, I don't.
Oxygen? Okay, and do you ever have do you have shortness of breath at times?
No, I don't.
Okay, and then I think that's it. Did you have any questions or concerns before I go get the doctor?
No, I'm good. Thank you.
All right, have a nice day. I'm gonna wash my hands again. All right.